What is inflammation? Inflammation is the body's natural process of fighting against harmful substances such as infections, injuries, allergens, irritants, and toxins. The inflammation process causes the body to release chemicals that trigger a response from the immune system to address the source of the inflammation. Types of inflammation. There are two types of inflammation, which are acute and chronic inflammation. Acute inflammation is short-term and typically a result of an injury or infection. For example, soreness after working out or swelling in pain after an insect bite are examples of acute inflammation. This is your body's way of protecting itself, and it plays a crucial role in healing. Symptoms of acute inflammation include pain, redness, swelling, heat, and loss of function, usually due to pain or swelling. Acute inflammation may need short-term treatment, such as over-the-counter pain medication, cold compress, or antibiotics in the case of an infection. The second type of inflammation is chronic inflammation. This form of inflammation is devastating to the body and lasts much longer than acute inflammation. It can persist for months to years. A common and modifiable cause of chronic inflammation is our diet. The diet that is high in processed and refined foods increases the risk of chronic inflammation. Specifically, these foods contain chemicals that triggers an immune response. Persistent exposure to these chemicals leads to prolonged inflammatory process in the body, causing a cascade of events that attacks and eventually damages healthy tissue in the body. Chronic inflammation could be a silent condition, which means its impact is not immediately evident. Additionally, symptoms of chronic inflammation could include pain, fatigue, mood disorder, and weight gain, which are nonspecific and could be easily attributed to many other conditions. Scientific studies have linked chronic inflammation to many chronic diseases that plague the modern world today, such as diabetes, arthritis, bowel diseases, cancer, cardiovascular disease, just to name a few. How to manage chronic inflammation. The best way to manage chronic inflammation is preventing it. You can manage chronic inflammation by consuming a healthy diet, specifically avoiding highly processed foods, refined foods, fried foods, sugar, red meat, and unhealthy fats such as saturated and trans fats. A healthy diet consisting of olive oil, fiber, leafy greens, omega-3 fatty acid, fruits, and vegetables can help reduce chronic inflammation in the body. Olive oil is high in healthy monosaturated fat called oleic acid. Oleic acid has been shown to reduce inflammation in the body. Additionally, olive oil is rich in antioxidant, which also reduces inflammation. Diet that is high in fiber can help reduce inflammation. Multiple studies have found that consuming a high-fiber diet lowers levels of C-reactive protein in the blood, which is a marker of inflammation. Leafy greens like spinach and kale have loads of antioxidants, which have been shown to reduce inflammation. Additionally, studies found that consumption of leafy greens can also lower levels of C-reactive protein in the body. Fatty fish such as salmon, mackerel, tuna are high in omega-3 fatty acids, which have anti-inflammatory properties. Research has shown that consuming these types of fish can lower C-reactive protein levels. Fruits that are high in antioxidants, known as polyphenols, can lower inflammation. Examples include all types of berries, plums, pomegranate, and red grapes. And finally, vegetables that are high in antioxidants such as tomatoes, onions, just to name a couple, can lower inflammation in the body. Thank you for watching this video. Hope you found this video helpful. If so, please comment below and click the like button. Remember to subscribe to the channel and hit the notifications button to stay up to date on latest videos.